So aside from the vascular updates that you gave, in terms of pigmented lesions and workup for those?
Yeah, so we always think about tuberous sclerosis in kids and neurofibromatosis, and families often come in very concerned. And for the brown spots, which are the cafe au laits that we need to worry about in terms of working up tuberous sclerosis, if you have one large brown spot, very big, large, only one, you need to worry more about McCune Albright, but that's incredibly rare. And those kids we generally just follow. We look for other signs, which would be precocious puberty or bony changes. It's rare as hen's teeth. What's more common for us to be concerned about is a child who comes in with a few brown spots. And the pediatrician's worried and the mom's worried, does this mean my child has neurofibromatosis? So oftentimes with very young kids with brown spots, you're going to be watching them. I mean, you ask about family history. Certainly if there are other people in the family with neurofibromatosis, it raises the risk. You're going to want to check their blood pressure, make sure that they don't have scoliosis, normal size head, check in the armpits and in the groin. You know, we always want to look there for axillary freckling. But most of the kids won't. Yeah, now the eye issue that you're pointing to, really young kids, it's not helpful to do the eye exam early on. Really, as they get older, more 6, 7, then we start to examine the eyes because the findings that you would expect generally aren't present really early on. But neurologic exam is important in the kid's development. So what happens most of the time is you look at the number of cafe au laits. Usually they don't have more than 5 that are large. Usually they don't have the other signs, and you just follow them.
And lastly, what about congenital nevi and that conversation that we have about parents in terms of the potential for malignant change?
There's lots of good news on that front. Ash Margoob and his colleagues have been following children in registries for the last decade, and what we've discovered is that size matters, and the very big ones are much more likely to be a problem than the very small ones. And before you go doing major excisions of a very large lesion, you'd want to make sure that the child doesn't have evidence of melanocytic cells elsewhere in the mesentery or in the brain. So if you have a child with a giant bathing suit congenital nevus at birth or early on, you're going to be concerned. Those children often will end up getting an evaluation for leptomeningeal melanocytosis present elsewhere. Little controversy about when to do the MRI on those kids because people worry about doing general anesthesia in very young children now. But those kids need to be followed. But the average Joe, again, I keep talking about the average Joe who comes into your practice, but that's what we deal with most of the time. They have a small or medium-sized congenital nevus. The risk for those is exceedingly small. So reassurance is generally the word, and following them. So small and medium-sized congenital nevi, obviously if one border looks black and asymmetrical, you're going to take it out. For the most part, we follow these children, and the risk is very low in those lesions.
In that category, square centimeters-wise, what are we looking at?
Well, in the past, we would say that anything less than 1.5 centimeters or smaller, that's a small, and then there's your medium, which was sort of like 1 to 10 to 20, but that's the problem with that was in adulthood. So it'd be less than 20 centimeters square diameter, 20 centimeters in adulthood. So how do you know what that is when they're a baby? So there are figures for the head versus the body, and you can look those up. But generally, what you're going to be dealing with is the smaller ones, and even the ones that are borderline. So let's say one is, 10 centimeters and sort of a borderline. That's much less risk than the child who comes into your office with a bathing suit nevus, or one that's very extensive and has a large surface area.